My name is Fata Sisa with Kerasu Home Care. Thank you for tuning in. It's June 20 today, and I am going to talk about Alzheimer's and related dementias. Alzheimer's is the sixth leading cause of death here in the United States. It is by far the most expensive disease in this country as well. In this year alone, care and support for Alzheimer's will cost the United States about $305 billion. And this trajectory is projected to increase annually, which we have seen that trend. And June is Alzheimer's and Brain Health Awareness Month. So I'm going to do a series of videos to highlight some issues with Alzheimer's and caregiving and families and loved ones that are involved in that arena. Basic information on Alzheimer's: it's a memory loss that interferes with daily living. So if not just any kind of memory loss, but if somebody is experiencing memory loss that is interfered with their familiar tasks that they do on a daily basis, now you're noticing they're having trouble executing those tasks, that's either Alzheimer's or other related dementia. It's also exhibits confusion, agitation. The person may be confrontational, so some changes in the personality of that individual, and also misplacing things that they could not retrace. We all misplace things, and sometimes, most times, people will be able to retrace that. But for those with Alzheimer's, it's a tough thing for them to be able to do. So if you see something, and if you see something of those kind of symptoms in your loved one, it will be a good thing to go check on those folks, get a evaluation to see what's going on. Other things to look for is judgment. Making sound decisions on their own, things that are noticeable, that these things are off. So judgment is definitely not intact. That will be also another sign. So one other thing I wanted to add on this is that COVID is still here, and even though people seem to be going about their daily lives and thinking what the new normal, and maybe even thinking we got this, but in my opinion, we don't, because there is no cure to it, just like Alzheimer's is. There are some measures that you could take with COVID for preventative measures. Those would be wearing masks, exercising those physical distances, and washing hands and not touching your faces, and all those expert advice that we have. Those are things that are really important to continue to do. Now, how is this related to dementia issues? You and I are able to follow those directions. Unfortunately, for people with Alzheimer's, on a day-to-day or on a minute-to-minute, they are forgetting to do what's needed, what you have instructed them. So they wouldn't remember to do the ongoing hand washing and don't touch your face kind of thing. I'll stay away from that individual. They just simply don't have the cognitive ability to be able to do that. So it makes it really hard for people with Alzheimer's to be able to follow those instructions. And therefore, we have seen that in the elderly category, people with Alzheimer's actually suffered COVID more than the other groups within the senior population. And of course, Alzheimer's is not only a senior issue, because we have seen a jump in early onset Alzheimer's, which people in their late 40s or even mid 40s up are actually being diagnosed with early onset Alzheimer's. So it's not elderly only issue, but really we also know that age is a factor to is a risk factor for Alzheimer's. So we've seen more of it in the ages 80s and above. So having said that, people who are caring for those with Alzheimer's have an extra challenge in tackling these COVID era issues. Some of the tips that I would give for working with those with Alzheimer's is do a lot of queuing. Also have, especially for hand washing, a lot of reminders, obviously, but also for hand washing, like around the sink, put out a picture of someone washing their hands, and also a write-up to say wash your hands. Hopefully that will help them, remind them. It could even be a picture of themselves by the sink, you know, in the bathroom, or just a little write-up to say wash your hands would also trigger a memory. We do that a lot with our folks when it comes to phone solicitation, because some of the phone calls are unwelcome phone calls, like how do I say this, telemarketers, so that they don't fall prey into it. So we put example of don't pick up the phone or something like that. That way they're not just picking phone and talking to the wrong people. But anyways, I think that would be a good reminder for them. If you're not in the same place with them, it would be good to call them during the time to take medications as a reminder, and not rely on them to actually do that. We know their issues are memory issues, and medication is an important one to keep routine of that to happen. And we know that there is also a lot of people with Alzheimer's who still stay in their homes and independent, in a way mildly independent, but needing those reminders. So obviously that would be something to check into for the most part. One other thing with Alzheimer's is that, as we are talking about this, there will be a lot of people that you are caring for that are exhibiting these symptoms but did not get the formal diagnosis, because we know, unfortunately, only 45% of people with Alzheimer's get the diagnosis. So that leaves about 55%, over half of people who have Alzheimer's don't get the proper diagnosis. So these things may apply to people that you're helping that actually did not get the diagnosis itself, because there's a lot of people out there that did not have the diagnosis. So that would apply. This will apply to those folks as well. So that will be it for this video. I'm going to try to keep it short, because I have a series of things that I'm going to be discussing, including how to manage their behaviors. But I want to make sure that I'm not giving you like a huge, taking too much of your time on one video. So I will just stop here, and I'll be back for another series, another video on Alzheimer's. Thank you for watching. I hope you all are staying safe and healthy, and keeping all those good guidelines that are in place, so that we can all remain, again, healthy and well. Thank you. Bye-bye.